Greetings. Mansete Nkwenebere, the Honorable Dr. Nicholas Ngusanto. I'm a member clinical psychologist. Where it means say clinical psychologist means say I be the person where it attend to mental health patients alongside a psychiatrist. As a clinical psychologist, I me I dey do assessments and evaluation alongside diagnosis and treatment planning with talk therapy. Where it means say the person, another part of the treatment where the person gave a stay into therapy for a long time, now me I give you the sessions. If you go up to 14, 20 sessions, 30 sessions, so one a lifelong treatment, depending on the severity, how severe the patient situation be. So a two phase of treatments be involved in mental health diagnosis, where it be say through medication and therapy. So they handle one part, then the psychiatrist, as well as the psychiatric nurse practitioners and MDs, they handle the other part. So basically, I'm a role that and I waited what they do for a living. Now I come here today because this palaver for mental health don't be a very big issue for the community. And we own immediate challenge, not be the mental health itself. For inside Quen, neighboring villages and Cameroon in particular, including Africa, we get with way the idea or the notion where people then get and say mental health na a superstitious illness. It be linked to witchcraft. It be linked to people the way they be bewitched and others. So it don't make now most of patients that they fear for come in the open, for declare, say I they face this challenge or I they face this challenge because they go stereotyping. They go looking like you don't inherit that witchcraft or you don't be bewitched. Or they give go through evil forest, like as they been doing before for Nigeria with some patients. So for we for go about wiping that notion and also wiping some of the negative injunctions the way they did it. How we go do now be left to we health practitioners and mental health practitioners for come out for educate one. First, as you know, if treat which way you don't know, we have to identify the reasons then why this kind of notion they will go on for society. First, you got to know say there was the shortage of healthcare experts in our community and people who had not had the knowledge and training. So if you never get knowledge and training in this thing, how you expect for tell people them what way they give a do. Now we be blessed so community don't get that kind of people. Then secondly, we be get scarcity of behavioral health units and clinics. You know, like for Cameroon, we begin at only Santo Jamo Hospital. Now, for only do if you go see person like me or like psychiatrist, a psychologist or psychiatrist for diagnose the issue. But now, you only with a telephone call, I will give you everything you need. Although we must also see you in person for see eye contact and body language in person. Then you get the biases them where be links to the illness, be Western medication, not the work and anything where they come from white man, it be attached to colonialism, slavery, and exploitation. So some people they be abject, they be totally reject anything where they come from white man because they don't trust them. But now some of us they here, we don't study, do research on the issues, them on the medication and other things. We say they work. Then you get stigma coming from the beliefs of witchcraft, spirituality. People they go spend with their patients for prayer mountains, for delivery, sleep for mountains, and offer sacrifices to the gods, just because of say the 1 million person where don't be bewitched or cursed, be healed. That's kind of treatment they exist for Nigeria and other places who will do research for they will see them. And that punishing of people, banishing of people out of the villages, and throwing even children and other patients into evil forest. Be the one of the aspects them as punishment. But now we don't move away from there. with the availability of knowledge and science in this and increased expertise, we bring one and knowledge say this is an illness like any other illness that is treatable. Another reason that the socio-economic barrier of affordability. People don't get money, and so as they don't get money, they find easy way for hide under all these excuses. Yeah. However, in as much as we talk about mental health and local treatment and remedies, we would own research on this field. They always tell we say, why would they condemn the third world practices? Those of herbal doctors and prayers don't also work, because if you know be the work, they don't figure the means where they hold their own patients than before now. But however, we go always encourage them through a treatment process. We'll call it say assertive combination treatment or assertive community treatment, whereby it's a holistic model for bring all these treatments into one setting and see how we help them while avoiding medication clash. Now, all that I tell una today for demystify mental health and for tell una say it be easily accessible nowadays. Treatment work. There is two-facet treatment, psychotherapy and medication management, and try to give a call to an expert, even phone call to get diagnosis and treatment. It is an easy disease, just like any other disease that can be treated. Thank you. I will see you people again.